Hi, this presentation will cover the topic of young mortality, and that will include infant mortality and other subsets of that. We can begin by looking at age-specific mortality rates. This is the United States for 2012, and what you see is this kind of J shape because we have low mortality rates, particularly at younger ages, going up to over 85. But you notice on this side that the under 1, and although it's less noticeable, the 1 to 4 is also slightly higher than the 5 to 14. So there's a slight U or J shape going on here. Infant deaths by age of infant in the United States, that's what we see here. The first category is what we call early neonatal, late neonatal, post-neonatal, and we'll talk about those. This is across time. So early neonatal has to do with the first 7 days of life. You see the rate is really quite high compared to late neonatal, which is between the first and fourth week of life. And post-neonatal is up to age 5 after the first year. So what we can take away from this patterns is that the greatest vulnerability to children is in the first week of their life. If they survive that and make it, they have a much greater chance of making it to the first month of life. Then there's a slight increase again in vulnerability through the first year of life, followed by again some more declines in terms of vulnerability. There are differences when we look at ethnic group there are ethnic group differences here. If we compare European and African American descent, for 2010, you can see that the infant mortality rate for European Americans nearly half that of African Americans. So this is a major concern, and that pattern has held has been fairly stable over time. Although some signs of hope that for both the groups, the infant mortality rate has been declining. It's down 5 for African Americans, which is a major improvement. But still unacceptably high, of course. And for European Americans, it has declined about 2. Again, 5 is fairly high, but on a global standard, ranks fairly well. When we look at other countries, for instance, we'll see that. Neonatal mortality rates, we see a similar pattern. The rate for European Americans, about half that of in this case, we're looking at all minority groups combined. That pattern has also held up in a fairly stable way over time. This, by the way, the years are going down this time, so now we're looking at improvement by looking down the table. I know it's kind of confusing because on the previous slide the years were arranged in the opposite direction, but just wanted to point that out. So the nice thing is we are seeing improvements. The bad thing is, of course, that the rates are still so high, particularly for minority groups relative to Europeans. So therefore, when we think about causes of infant mortality, we're looking at ethnicity as a major factor, but we also need to consider the roles of social class and gender and the way that those are correlated. On this graphic, we see for 2013 the infant mortality rates for 14 select countries, meant to kind of highlight some of the vast differences that exist in the world. And I do apologize for the quality of this. I know it's hard to see, but I will kind of walk through this. On the low socioeconomic development scale, we have, for example, Gambia, and it has an infant mortality rate that hovers just below 50. So you'll recall the rates we were talking about in the United States are all below 10. Of course, there are within country differences by ethnic status and so forth. The United States near Cuba, slightly worse infant mortality rate than Cuba, slightly better than China. Japan has one of the lowest, along with Sweden. Portugal, European countries tend to have some of the lowest infant mortality rates in the world. They have wide access to health care, universal in fact in most cases, which accounts for why their standards are better. In the medium socioeconomic development scale, China, we mentioned, Albania, Saudi Arabia are keeping close company there. In the sort of medium to low socioeconomic status, we've got some South American and Central American countries, along with South Africa coming in there. Now these levels were in the 30s, the mediums sort of in the teens up to 20, and the highs under 10. Those are the general patterns. So certainly one of the benefits of living in a more developed world, part of the world I should say, or country, is the odds of infant mortality are far lower. And that's going to wrap up our discussion of young mortality patterns. Thanks for watching.